Pain is a big reason why our dogs show behavior issues. Because of that, we find medications and ways to keep them comfortable in their skin while trying to take care of their health as well at the same time while giving those medications. So when we stumble into a medication that tell us that we are not going to have many side effects and also we're going to relieve the pain in our dogs and it promises us to have a better result with the behavior, then that sounds very, very compelling. But is that really what's happening? And with this new study, what comes to light that we need to consider? Hi, my name is Paty Greki. I'm a certified clinical animal behaviorist. I'm also a certified separation anxiety trainer and a dynamic dog practitioner. We are here today to talk about how to have long-term behavioral transformations, taking care of your dog's well-being, which brings me to this amazing topic, which is the polemic around Librela that's happening at the moment. And this polemic is happening because we use this medication to help our animals, and now they are reviewing a few things, and it might be that we need to rethink how we see and how we use Librela. But how can we know if this is information that is coming to light reliable or not? So we're going to discuss this a little bit. We're going to discuss their findings and how to read this study. Today I have with me amazing Lauren, and she is our vet behaviorist and she is a vet practitioner, so a GP, but also she is a vet behaviorist, so she's specialist in behavior, which brings us to the topic today between health and behavior and also the medications that we're using. Lauren, thank you so much for coming and discussing this. Do you want to introduce yourself first?
Yeah, sure. My name's Dr. Lauren Ward. I'm a small animal vet who has a postgraduate diploma in small animal behavior medicine as well. So I've worked as a GP vet for almost 7 years now, so lots of experience. I've been working as a behaviorist for about a year now.
Amazing, great stuff. So let me start from the beginning. What is Librela? How does it work? What is the mechanism of action and what this is being used?
So Librela is a once a month injectable way that we're starting to treat osteoarthritis in canines. So it works as a nerve growth factor inhibitor. So basically it binds to nerve growth factors in the body, which help to, they're found in cells all throughout the body, and they help with pain signaling and homeostasis things in muscle repair and things like that. They're everywhere. Librela specifically binds to this receptor and it stops pain from being signaled through the body. So we're not having any effect of stopping the arthritis process, but we're stopping the pain from actually being recognized by the body.
Okay, so basically sensation, nothing else. Mm-hmm. Brilliant. Okay, and why do vets think of Librela when they're prescribing, or what is the benefits of Librela over other medications?
There's a lot actually. So Librela is given once a month by either a vet or a nurse. So we're doing regular checks once a month that what we're doing is working, that we're seeing the animal, we're getting them in clinic, we're having conversations with owners. So it's a good way to check in once a month. Sometimes when we give painkillers like NSAIDs or things to give at home, the owners don't always feel comfortable giving them. Maybe the dog doesn't eat a day, so it misses a couple doses and things like that. By giving an injection once a month, we know consistently that they're getting the medication. It is a newer drug, so there's been kind of a big hype around it and lots of research being done and lots of prescribing and things like that. So it is maybe proportionately more prescribed recently because it is a bit newer. We still give NSAIDs and things where we kind of look at every individual case on a case-by-case basis, see what exactly the dog needs, what the owner can do, what the goals are for treatment, and kind of do an individualized approach to each case.
Can I ask you, you mentioned NSAIDs, and can I just break it down? What is that? Like, what's the name of that for normal people that have dogs?
It's a non-steroidal anti-inflammatory drug. Okay. So it's a non-steroid that helps to target inflammation and pain receptors.
So it would be like the Metacam that we give them after surgery or something like that?
Exactly. Metacam, Rumacam, Caliprant, all of those sorts of things.
Okay, brilliant. There is one thing that I hear a lot from vets, and I just wanted to see your view on this. I hear as well that the way that Librela is metabolized by the body is completely different. So rather than going through certain organs and possibly damaging them as other medications like anti-inflammatory medications, it would just directly go to this nerve that you mentioned and kind of stop the sensation of pain.
So non-steroidal anti-inflammatories are metabolized by the liver and kidneys and can have quite strong side effects for the gastrointestinal system. You can have things like ulcers or pain. You can have vomiting and diarrhea side effects and things like that, which can be quite damaging for the animal. So we always use with caution in those cases. But like you said, Librela is an injection that works kind of directly on that nerve growth factor, doesn't kind of bypass all those mechanisms.
Okay, so I also normally see vets using like blood tests in the middle of courses of anti-inflammatory medication.
Yeah, absolutely. That's to know that the liver, the kidneys especially, can handle those medications.
Brilliant. Okay. And all medications have to have studies before releasing them, right?
Absolutely.
I imagine Librela had some of those. Do you mind just going through like what they found when they did this study?
Yep, there would be safety studies, there would be efficacy studies. The makers of Librela, which would be the company Zoetis, would have had done extensive safety testing for adverse events, for overdosing, for scheduling of dosing and things like that. So in America, in the UK, in Europe, all of this would have had to go through extensive safety testing before being able to be licensed as a use of product.
Okay. And what did they find in terms of efficacy for this medication?
That in proportion to dogs being treated by the placebo, that there was enough to be licensed for use in osteoarthritis for pain relief in dogs, that they found that compared to the placebo, that the dogs given Librela had more pain relief, more kind of quality of life compared to those given the placebo.
Brilliant. Okay, so this study, it says that is randomized, is blindfolded, it is placebo controlled, and is done in 287 dogs. So I just wanted to put this out there because we're going to talk more about the details of what a study, a reliable study will show, and things that we look into before we read a study and deem very good. But I think it's important for us to remember those numbers because we're going to talk about them later. And it was also a owner assessment, right? So the owner would tell them if they saw a change basically in the dog. There is a critic in this study, and this is my critic as well. Not sure if you find the same thing, but basically this study was done for 9 months in the first and second phase. And after this, there is not much more that was done. And also we don't know what is the effect of this medication in the body long term. And it's such a different kind of mechanism, right?
Absolutely.
So I just wanted to check with you, like, what do you think of the study in itself? And
so nerve growth factors and those sorts of injections like Librela have been used in human medication for a long time, for cancer, for autoimmune diseases. So it's not necessarily a new drug, but for animal medication, it is. It's only been around, it was licensed in 2000, Librela was. So it is comparatively a new drug. So we only have 4, maybe 5 years worth of studies. So like you said, we don't know the long-term implication. So we do have to have a bit of trepidation when we're using the drug. We need to be cautious. We need to, like I was saying before, take each case individually, look at the animal that's in front of you, kind of do your exams, do blood work every so often, do potentially x-rays if things aren't going as we would expect by what the drug sheet says. So each case is really individual. The fact that the study was only 9 months is a medium-term study, I would say. It's not a long-term kind of retroactive study. We're not looking for years and years worth of data, but that's kind of with the nature of the drug, that it's not been used for so long. So we don't have that really, really long case history of things to be able to actually research.
so basically now is the time that we would be able to do that, right?
We're actively doing research and seeing kind of the long-term effects now as we're starting to use it for 5+ years now.
Brilliant. Okay. And so then now there is a contrasting study that came up, and I just wanted to check with you what this new study says and how do you feel about it?
So the new study came about. It's a kind of retroactive study. So we're looking back at past events and reports from vets. We're looking at 19 cases that have been reported through vets on an online forum for adverse events. So if you give a drug and something happens, say you get a side effect, you have swelling at the injection site, you have some sort of event that you're not really expecting, you should, as a vet or as an owner, report it to your vet, report it to the drug company, say, look, this is what happened, we weren't expecting this, or this is way more than what the safety sheet said. Let's log this as an adverse event, we'll call it. And then the drug company should look into it, should keep a log of it, should kind of be able to catalog these events and see what exactly is going on in the population that the drug is given to. So there's 19 dogs over the last, I think it's since 2021, when there was the first one reported, where specific and severe adverse events, specifically musculoskeletal adverse events, have been reported from everywhere from fractures to luxations of joints and things like that, to even euthanasia. So we're looking at a small group of self-reported events from vets about adverse reactions following Librela injections.
Okay, so let's break this down. So basically the musculoskeletal would be the joints and the muscles and all the tissue.
Ligaments, tendons, joints, all of that, yeah.
Okay, and then this medication was designed to help dogs that have problems in that area.
Specifically with osteoarthritis, yes.
Okay, so we're trying to treat something that is that problem. And the side effects that we are seeing at that problem as well.
Yes.
So what I think this study was trying to understand is Librela worsening the issue or is Librela kind of helping the issue? But you said in the beginning that Librela doesn't try to make the osteoarthritis better.
Yeah, osteoarthritis in itself is a progressive disease. So Librela is, while we're stopping the pain signals from being recognized by the body, we're not building new cartilage. We're not stopping actual inflammatory processes from happening. We're just stopping the pain from being recognized by the body. So in itself, osteoarthritis is going to keep kind of degrading. The joints are still going to keep getting worse over time. We're just stopping those pain signals from being recognized by the body.
Okay, so I think what was really interesting for me in the study is that we're seeing a side effect, a symptom that we might be judging as a side effect, which is exactly the same problem that we were trying to treat. So what I was thinking is, could it be that the Librela is not working in those cases, and that is the natural way that is developing, or it would develop without having that medication, for example?
Yeah, I think that's an interesting question to ask, and it's one that we probably should be asking in the future. Librela will target the nerve growth factor. So if we have problems in the joint, in the muscle, in the tendon that aren't related to the nerve growth factor, you'll still potentially have pain, have problems, have lameness. Those are the kind of things being associated with the osteoarthritis, that not necessarily due to just Librela, but by other kind of comorbidities happening at the same time.
That's really interesting. I think there is a few points that I want us to comment on. So I saw a few phrases in the study, and I think this is more related to how reliable the study is. And one of the phrases, and I'm going to start with the most, I think the most important one, is it says the disproportionality of the analysis doesn't support the hypothesis. Can you break that down for us?
Yes. So the way that they did the study is what's called a disproportionality analysis, like you said. And so basically that is like, is the specific adverse event reported more frequently in a particular drug than it would be against another drug? So say, are the adverse effects of Librela more than, say, against Metacam or something like that? So it's a retroactive looking back study of data of adverse reported events. So their hypothesis did not, the results they found did not support their hypothesis that Librela would have less adverse effects than other drugs.
Okay, and this means that they are comparing Librela, which works directly in the nerve, with a medication that is an anti-inflammatory medication.
Yep, they used 6 non-steroidal anti-inflammatory medications that are commonly used for osteoarthritis.
And as you said, it has a completely different kind of mechanism of action, the way you metabolize in the body and everything.
Absolutely.
Does it make sense to compare those two things? It seems like comparing apple with pear.
It is. So they're trying to compare a brand new drug to see the safety of it, I think, is what the aim really of the study was. So Librela is the only kind of medication we have like this, so we can't compare it to another nerve growth factor specifically for osteoarthritis. There's used for different medications or different problems in dogs for allergies and things like that, but not specifically for osteoarthritis. So while it's maybe not the best, it's the only thing we actually can compare to. We don't have another sort of injectable like this to compare it to.
Brilliant. It makes total sense. And another thing that was brought up by the study is that it did not found causality, and I think this is an important one. So when they say that, what do they mean?
So because it was a retroactive study, because they didn't have a control group, they didn't have a kind of long-term study looking at Librela versus, say, a placebo or something like that, they can't say specifically with actual fact that they can back up that Librela directly causes issues that they're seeing, be it fractures, be it joint problems, things like that. So while they can strongly be concerned, that's the kind of the language they use, that there's suspicion, that there's, needs to be looked into, we can't directly say that Librela causes issues.
Okay, and when you say about the type, like the design of the study, when you talked about the control group, why the control group is important in the medical setting?
So if we're looking at a drug, we need to see exactly if it's this drug or if it's some other kind of drug interacting. So having a control group that has a placebo, be it water, be it sugar pills, something like that, basically a subset of the population that's not getting the medication. So we need to compare those two populations to see, does the population that's actually getting the drug versus the population not getting the drug, are we seeing more side effects, more adverse events in the one actually getting the medication versus getting the placebo? If you don't have a control group, it's really difficult to find actual causality.
And I imagine this is also because imagine we are treating old dogs, so then those old dogs will have certain things that are going on in their body.
Yeah.
So the group that didn't take would also have things going on with them, right?
Absolutely. And I think that's one of the things that in the study that people are taking issue with is that it was only looking at osteoarthritis adverse events. It didn't take into account that a dog might have kidney disease or diabetes. It didn't kind of take the comorbidities with the dogs that might have adverse effects on the osteoarthritis. It just looked at arthritis specifically, not the whole kind of holistic picture that was going on.
Okay, brilliant. And in the other study that we saw from Librela, we saw that was also randomized. So can you talk why this is important as well?
So having a randomized or a blinded study, you don't know, the owner of the dog doesn't know if they're getting the actual drug or the placebo, so that there's no kind of inherent bias in the study. If you know that, yes, I'm taking the drug, that it's going to work, you're going to have some bias. There's going to be some placebo effect regardless if you're getting the actual medication or not. So having a randomized, there's no kind of pattern to the dogs getting it, to the dogs not getting it, or blinded where you know or you don't know that you're getting it, is kind of the most scientifically sound way to get an actual result with your hypothesis. Okay,
brilliant. So this study was actually a case study, right? So it was not randomized.
Nope.
It was not. There wasn't the same designed as the other one. So I just wanted to check with you what normally can we understand from case studies, and like they are helpful.
Yeah, definitely.
But what is helpful about this study? I think this is the important part to kind of extract.
I think case studies are a good way to look back and kind of holistically look, what did we do? What worked? What didn't work? What were the kind of cofactors that included in the study? What was the eventual outcome? So it could kind of, in a way, increase our knowledge of what to do going forward in cases, can give us some kind of pause and skepticism of like, okay, well, maybe we have these subset of dogs who had some adverse events. If I see a case similar in the future, I can think, okay, maybe this is looking a bit similar to a previous case, and maybe I'm a bit more cautious. Maybe Librela isn't the first thing I go for. Maybe we kind of added in down the line with increased monitoring, with increased blood tests, with radiographs, things like that. It just adds to our knowledge about our confidence of being able to prescribe Librela going forward.
Brilliant. So there is loads of important information.
Definitely,
there.
Yeah.
But I think what what we realize when we read this study is that that is not a reason to stop prescribing a medication.
Not in my opinion. So I think osteoarthritis is it's a huge and it's a difficult topic. Like you were saying, it's old dogs. They might have 100 other things going on. It's a really individual picture. So Librela might not be suitable for every single dog, and which maybe shouldn't be the first thing we reach to. It should be having a conversation with the owner, taking the picture of the dog that's in front of you. And maybe we reach for Librela, maybe we reach for something else. But I don't think this study in itself is a reason to completely cut out Librela from our options.
Okay, Grace. Because Librela is a very important medication, I believe, for most of my clients. Some clients that can't take other things because they have problematic situations going on in their body. And the other medications would damage more than possibly Librela.
I think it's a really holistic approach that everything we're doing is for the good of the dog, for the betterment of the quality of life for the dog. So if Librela is aiding that quality of life, if we're seeing better results with Librela compared to Metacam or other tablets maybe, then Librela might be the best option. But we really need to do everything for the good of the dog that's in front of us as a whole picture.
And I think it's also important that this came out, because at the same time, we can't be using a medication without knowing what is the long-term effect of that. So that was always something that I see vets doing, is something that I discuss with the clients every single time when Librela is introduced or discussed. Because truly, we don't know much about that.
Absolutely.
And I think it's something that we're learning, and I think this study helped us to learn a little bit more. I'm just a bit worried about the panic that it generated. Because everyone went like, oh my God, Librela is the worst thing ever.
Yeah, it did unfortunately go a bit viral on social media, and it kind of got picked up by dog walking circles, grooming, those sorts of things. And there has been a bit of an unfounded panic of people just kind of seeing the headline that Librela causes all these issues. But if you look deeper into the study, you know, like we're saying, it was a very small retroactive study with maybe not a case control group and things like that. So the study itself said it was limited in the kind of implications it had going forward. It recognized that it can't exactly say a causality between Librela and these adverse events, but that more research is needed. So I don't think that, unfortunately, it did go viral, but the panic that people are having around it, it's good to have these conversations. It's good to be skeptical. It's good to kind of ask your vet these questions, but it doesn't necessarily warrant the panic that's kind of ensued over the last couple of weeks.
And it's important for us to put in check the big corporations that sometimes are slightly difficult to deal with. And they have to take those situations in consideration and make sure that they are doing their job to keep our dogs safe.
At the end of the day, this is still a safe and licensed product. It wouldn't have had the license given if it wasn't tested to be proven to be, in the majority of cases, to be effective and safe to give.
Yeah, I think that's a very important part of the process. Okay, so let's talk a little bit about a few questions that I have about the study in itself and like the results that we got. Is the results that they found is said to be worse than expected. But what I wanted to understand is, could each individual progress osteoarthritis in a different way, or are we expecting all of them to progress gradually and exactly in the same way?
Yeah, so individual dogs are going to have individual ways that they respond to osteoarthritis. So some dogs, you know, you might have a dog who gets to 13, 14 before it gets to, you know, a bit lame, a bit stiff, that sort of thing, and gets diagnosed. You might have a poorly bred dog who, unfortunately, at 2 years old, its elbows start to be a bit thick and a bit sore. So each dog is really individual. It's not necessarily A happens, then after 6 months B happens, then after 6 months C happens. So each dog, each case needs to be treated as an individual case. You can't really generalize over the whole thing.
And is there any other things that would affect, so for example, with those dogs that were being treated, this 19 cases, would maybe exercise affect, or diet,
Definitely.
or supplements, or what
Absolutely.
could affect?
So having, being obese, having more pressure on your joints, that would be a massive thing for osteoarthritis and for the progression of the disease. The amount of exercise and the types of exercise. If you're constantly running or having really high impact exercise on your joints, that's going to degrade your joints more than just some swimming or gentle walking or that sort of thing. If they're on joint protecting supplements like chondroitin, green lip mussel, those sorts of things, those are all going to help to slow the progression of the disease, not necessarily treat or that sort of thing, but it's going to make a difference with dogs who aren't on those types of things.
Okay, so it does make sense that dogs would progress in a different way.
Absolutely.
Okay, so when we talk so much about randomized, controlled, blindfolded, all those things, we're talking about the importance of having those dogs maybe in the same age or same stage in progress of this disease, and then maybe like with the control and the non-control group, the one that's getting the medication, and then follow them for a certain period of time, and maybe have controlled amount of exercise,
Definitely.
weight, and things like that.
Or the kind of exercise you're getting, or maybe you're doing a bit of physiotherapy or a bit of stretching, a bit of muscle building, that sort of thing. To have the best result, the kind of cofactors need to be as close as they can, the same for everybody.
And it's really hard, isn't it?
It's very difficult, yeah.
For behavior, we have the same problem. So we have loads of case studies in behavior, right?
Definitely.
Because it's so difficult to say, oh, we're going to now measure barking or aggression, but we going to have everyone in the same diet and the same amount of exercise and same circumstance in the house and same level of mental stimulation. It's through so many things that can affect that dog.
And when you're having owner reported as well, each owner is going to have a different threshold as to what they deem reportable or not. So maybe if the dog's a little bit stiff from getting up, an owner might say, oh, he's just been sleeping for a while, or it's a bit cold and rainy outside, so maybe they might not report that, whereas other people might say, oh, he took one off step, that might be something to report. So even in individual owners, you're going to get a plethora and different thresholds of what they feel is reportable or not.
And I find that so interesting, this conversation, because I have loads of clients that come to me, and then I might point it out, look, we are seeing this, and the person goes, no, my dog is not in pain. And then, okay, no problem. And then a week after that person starts noticing what I pointed out. So the person's like, oh, actually, my dog started limping. But before, the dog wasn't limping. And then you start thinking, was the dog not limping, or the person didn't ever notice that? Because it's a different thing. And as soon as you start noticing, and it's not because we're bad owners or good owners. No. It's just because we didn't know. And as soon as you see that, you start seeing it more and more. Exactly.
I think as well with owners who are seeing their dog day on day, they might not totally clock in the change, the really gradual or slow change, whereas professionals like us, if we're seeing a dog every 2 weeks or every month, there might be a stark difference as we see day 1 versus day 28, which is when we give Librela, and you say to the owner, oh, this was not here before, when did this happen? And they might be like, oh, I didn't even really notice because it was such a slow and gradual thing. Then now they're kind of racking their brains to kind of remember when it first started or when they first started seeing it. So that's difficult as well.
Yeah, absolutely. I completely agree. Another point is that what I wanted to understand is I see a lot of osteoarthritis cases, and is it common for you to see osteoarthritis cases that would get worse over time, even on pain medication? So let's say they are on Librela or something else, but it deteriorates with time.
Yeah, so you have to remember that the dog is still aging, unfortunately. We're still getting degradation of the joints, of the muscles. We're still slowing down a bit. We're still having other processes, potentially other diseases happening, which are all going to inform on arthritis, on pain, on things happening. So unfortunately, it is, like I said earlier, a progressive disease that we're never going to fully stop or reverse the effects. We're just aiming to slow the effect and stop the pain that we're seeing as a result.
And what I imagine is, when you have less pain, you do more. And are you worsening the issue?
So that's something I tell owners so Librela normally works within the first 2 injections. That's when you're going to see the maximum effect. So around that first or second injection, I always kind of warn owners, you might see that they're jumping, that they're leaping, that they're wanting to run and run up the stairs and that sort of thing. We need to be really cautious because they might not feel the pain, but they're still potentially doing that damage, just not actually feeling it. So a kind of really individualized and cautious approach to exercise and walking and things like that needs to be taken on board as when you're doing these medications as well.
So I wonder if also when we see a case study, if we could be seeing that.
Definitely, there's a potential for that there of owners who didn't know, or just, oh, I'm just so happy that my dog can jump up in the car again and things like that, that they're just letting them kind of go full tilt without thinking that, oh, actually we need to be a little bit cautious that we're still having these effects.
Yeah, makes total sense. How about if the dog didn't have any medication? I think we touched this briefly, but I just wanted to make very clear, could the dog also get worse if it's not taking any pain medication?
Absolutely. If we're not having any kind of protective from joint supplements or weight loss or diet and things like that, and we're not blocking pain, we're not having any anti-inflammatory effect, we're not kind of modulating that pain response at all, then you're still going to see degradation in the arthritis.
Might be slightly repetitive. But this is something that's
make it very clear, yeah.
It's very obvious for us because we work with that and we're so used to seeing
it daily.
But it's so important to say, if this dog doesn't take any medication, would it have the same effect as what we saw in the study?
It might do. Yeah.
So, so I think this is when it really stood out for me. Really important for us to think about all those things. So we also have a similar mechanism of action medication that was used in humans. And I noticed in the studies that there was one that said that there was a quicker degradation in joints, but this is something for another subject. But also is said about placebo effect on humans. So it seems like they found a completely different kind of result with humans. So I don't feel like it's helpful for us to compare here. Yeah. But let's talk about the results that we found and a bit more specifically what we saw in the study. So there is 39% of the dogs were reported unknown. And what is unknown?
So unknown in a study is when we don't know the outcome. The owner didn't follow up. So while it sounds like, 39% of unknown, that seems a bit probably a bad thing, right? That doesn't necessarily mean that. That could have mean that the dog got better, that the symptoms went away, that the owner just maybe forgot about reporting that to the vet. So it does include cases that, maybe it got worse, maybe they went for a second opinion, maybe they completely stopped Librela and did something else. We don't know. So that 39%, we kind of can't speculate into what actually that means. So while it's the biggest percentage, it's kind of nebulous as to whether it's good or it's bad. But it is interesting that the biggest kind of percentage of cases or conclusions that we saw is in this unknown category.
I thought it was really interesting when I read that, because most of my clients, when there is a lot of silence, is because it's going well.
Things are going well. You don't need to check in unless things are going badly, unless, we need to do something else because what we're doing right now isn't working. So we need to be cautious about that because that is just our experience. But anecdotally, that's the evidence we have.
So we're not assuming anything, not assuming that this is good, but also not assuming that this is bad, basically. We just really... It's unknown.
It's unknown.
It's literally unknown. Okay, second point.
The side effects that they saw from Librela. So 22%, of the adverse events that they saw from Librela are recovering or in remission or have gone away with the treatment of Librela. So then the second kind of subset that we're seeing, once given Librela after the adverse effects have gone away, they're fine. We didn't have any kind of lingering effects from that.
And then we had about almost 10%, 8%, I think, that were euthanized, which I believe is not uncommon in older dogs and dogs that have a lot of pain. Yeah.
So we have to think that of that 8% that were euthanized, it might not have been that Librela was a direct cause. Maybe the owner was thinking, this is too much for me to handle. We're on monthly medications. We're on maybe some other supplements. The welfare of the dog, with all of these things combined, maybe it's just not ethical to keep this dog alive anymore. It's not saying that we gave Librela as an injection, it didn't work, we euthanized the dog. So that kind of 8%, still there are some questions around it, but is it necessarily out of normality for a study?
And also wouldn't be like complications that led necessarily to euthanasia, but it could be.
It could be. It'll still contain some of those, but it's not saying that all 8% of that is exactly because of that.
Okay, brilliant. Okay, so in reality, what we're saying over and over and over again is that possibly we have a study that is opening our eyes to loads of possibilities and things that we need to understand better.
Definitely.
But it's not conclusive.
It's not conclusive. I don't think we can say with this one retroactive study, one way or another, we should or we shouldn't give Librela. I think it's opened some interesting conversations like we're having, and that more research obviously needs to be done if we are having these adverse events. Not to say that it's not safe and it might conclude that, you know, Librela is totally fine to give, but it's worth having more research done. It's only a 5-year-old drug, so it is still pretty new. We still need to be doing these research and having these questions. But as an owner, I wouldn't necessarily feel 100% that based on this study, it's a reason to stop giving Librela totally.
Okay. So by no means we want to advocate for it or advocate against it. We're just trying to show what we think professionally. And this is the most honest that I believe we can be, which is we really don't know and we need more answers. So absolutely.
Yeah. Have a chat with your vet. They'll have this study. It's been in the media. It's been on kind of our minds as well. Have these chats, have these questions, have a look at your dog and kind of the whole picture together and ask and have a conversation if it really is the best or if there's other things we can be doing, if we can be more safe with doing blood tests or x-rays to see if it really is working or if we're having maybe some adverse effects, and then make a decision with your vet.
And I think it's very useful to have those conversations because pain at the moment is so underdiagnosed and undertreated. So this needs to have we need to have a broad understanding and bringing everyone into the conversation, not only the vet. I think it's really helpful. Lauren, thank you so much for coming.
Thank you for having me.
It was so fun. So we do one-to-one consultations. Lauren has her vet behaviorist consultations. So if you're struggling with anything related to pain
come see me.
Medication or anything like that, you can book with her directly. We also do mentoring for professionals. So if at any point you got very confused about what was going on and didn't really know how to deal with it, then you can come and have a conversation with us. And remember, don't accept anything other than happy. I'll speak to you soon. Bye.